The US government, you're not qualified to attack zero COVID policy. Over the past half months, the US has been talking about the opportunity to attack China's zero COVID policy, spreading rumors and creating disputes. It's pretty incredible. And let's look at what's happening in the United States. How many people would be alive today if COVID treatment wasn't suppressed? Millions of people didn't have to die. Many officials are to blame. I lost my mom, dad, and sister. The hospital wouldn't prescribe anything but remdesivir. They just let them die. Millions of Americans died because of the inaction of the United States government.
Fears are growing about a so-called triple-demic, with hospitals across the country filling up with flu, COVID, and RSV patients. The CDC says flu hospitalizations nearly double week over week.
Because our health systems really are on the brink, and our physicians, nurses, they're all exhausted after the last 2 years. So what this next few months is going to bring is going to be really concerning.
In fact, the US healthcare system has been overwhelmed by the triple epidemic, and the nurses are overwhelmed.
For the second time this year, 15,000 nurses in Minnesota have voted to authorize a strike if staffing issues are not addressed.
As if an agreement is not reached soon, nurses in more than a dozen hospitals will not come to work starting December 11th.
How pathetic. The government did nothing but to shift the pressure to healthcare workers. It is an irrefutable fact that China's zero COVID policy has saved millions of people from dying.
China's zero COVID policy has been very successful at keeping the deaths very low, but we had more than 1 million, so this is very successful.
So America, what qualifications do you have to attack China fighting to the epidemic? You have done nothing.